Good morning and welcome to the North Slope Borough Community Health Hour. My name is Olivia Kim, Health Educator for the Prevention Unit. This show is brought to you by the North Slope Borough Health Department. August is National Breastfeeding Awareness Month, and today we will be discussing pregnancy and motherhood with Terzioski and Theresa Kouadio. Before we get into the interview, we'll spend some time talking about the benefits and challenges of breastfeeding. Newborn babies need to eat at least 12 times in a 24-hour period, and breast milk is rich in the vitamins, minerals, and antibodies that they need to grow strong and healthy. As your baby grows and its needs change, so does the breast milk too. Breast milk is easily digestible and helps the digestive system to grow. As mentioned before, breast milk contains antibodies and other immune factors that help lower the risk of certain infections such as ear infections, asthma, lower respiratory infections, diarrhea and vomiting, childhood obesity, eczema, type 2 diabetes, childhood leukemia, or sudden infant death syndrome. Studies have shown that breastfeeding may be associated with improved cognitive and motor development. Breastfeeding also facilitates bonding through physical contact. Skin-to-skin contact is very important for babies and helps them feel safe, warm, secure, and loved. It releases oxytocin, also known as the love hormone, promoting a strong emotional bond between mother and baby. Breastfeeding has many benefits for newborns, but there are also benefits for the mother. For moms, breastfeeding can help you recover more quickly from childbirth. It helps the uterus return to its pre-pregnancy size and assists in weight loss. It can also reduce the risk for high blood pressure, certain breast and ovarian cancers, and type 2 diabetes. As mentioned before, breastfeeding releases oxytocin, which helps the milk flow and promotes bonding, feelings of calm and connection, and can reduce the risk of postpartum depression. Breastfeeding has many benefits, but it can also come with both physical and emotional challenges as well. Many mothers experience soreness in the breast, especially in the early days of breastfeeding. Another source of pain is engorgement, which can occur when breasts become overfull and hard due to excess milk. This is very common in the initial days postpartum and is usually alleviated once the baby starts feeding. Some babies experience difficulty with proper latching, which can cause pain and inefficient feeding. Some babies chew instead of sucking. Sometimes babies can be so eager that they will grab onto any part of the breast and continue to suck even if no milk is coming, leaving a painful bruise. Challenges with latching are sometimes associated with tongue tie, when the bottom of the baby's tongue is connected to the floor of the mouth, lip tie, when the connective tissue on the upper lip is too short and restricts movement of the upper lip, a high or arched palate, when the roof of the mouth is shaped in a way that is too high or narrow, and a cleft palate or lip. Sometimes a milk duct can become clogged, causing milk to back up, resulting in the formation of a tender red lump. If ignored, this can lead to a breast infection known as mastitis. You can treat clogged milk ducts by applying a warm compress before feeding and massaging the lump while feeding. Breastfeeding can also lead to thrush, a yeast infection that causes pink, burning, or crusty nipples. Thrush is typically related to the baby's mouth. Signs of oral thrush include white or yellow irregular shaped patches or sores that coat their gums, tongue, and the sides and roof of the mouth. Other physical challenges include oversupply and low milk supply. Some of the emotional challenges associated with breastfeeding are guilt, shame, disappointment, anxiety, and even depression. These challenges can arise from difficulties with latching, pain, insufficient milk supply, the pressure to breastfeed exclusively, or when breastfeeding does not go as desired. Some women feel that they are not providing their baby with the best possible nutrition or not fulfilling their role as a mother, which can be exacerbated by societal pressures and expectations around breastfeeding. Physical exhaustion from around the clock and nighttime feedings can contribute to stress and anxiety. Hormonal fluctuations during and after breastfeeding can also impact mood and potentially trigger or worsen symptoms of postpartum depression. It is crucial for mothers to have both physical and emotional support during breastfeeding challenges. If you are facing any of these challenges, you don't have to go through it alone. Reach out to your OBGYN, midwife, your baby's pediatrician, a lactation consultant, support groups, a mental health professional, partners, a trusted friend, or family member. It is important to note that due to the challenges mentioned above, constraints on time for working moms, and other personal reasons, some mothers feed their babies through pumping breast milk, a combination of breast milk and formula, or formula alone. Each woman's journey is different, and there are options available that will fit your situation the best. Breastfeeding is just one aspect of being a mother, and there are many ways to bond with and nurture a baby. We'll now move on to our discussion on pregnancy and motherhood with Ali Terzioski and Theresa Kouadio. Ali was born and raised in Borough. She is married to Robert Terzioski, who she shares 3 children with. She works for the Norfolk Borough and is a small business owner. Theresa is the coordinator for public health nursing at the Borough. She lives here in Borough with her wife and fur babies. She's a lifetime member of the American College of Nurse Midwives and has delivered approximately 1,000 babies. Okay, hello everyone. So today I am here with Theresa Kouadio and Ali Terzioski. We're going to have a conversation about pregnancy and motherhood. Before we begin, I'll just ask you guys to introduce yourself briefly for the audience.
Hi, I'm Theresa Kouadio, and I am the coordinator for public health nursing for the Borough.
I'm Ali Terzioski. I work for the National Borough, and I'm also a small business owner.
Thank you guys so much for taking some time to have this conversation with me today. With that, we're going to just jump right into the questions. The first question is, can you tell us a little about your own experience with pregnancy and motherhood?
So I'm a mother of 3. My kids are 2, 4, and 6. My pregnancies were all pretty difficult. I had hyperemesis with all 3 of them, which is like severe vomiting from the start till the finish. So pregnancy was not a very good experience for me, but motherhood has been, I guess, very rewarding and challenging at the same time. My kids are very close in age, so it gets very difficult when I'm working too, and going to the restaurant a lot, so that can be very difficult. But with all the support that I have, I'm able to handle it, I guess.
And Theresa, you had mentioned to me previously that you have to help deliver over 1,000 babies.
Mm-hmm.
So can you tell us a little bit about kind of your experience, like professionally?
Well, it really started with my own child. I've always lived in tiny towns, and I was given the option to have a physician or a midwife provide care. And why would someone want a midwife when one could have a physician? So I chose a physician. And the difference is that midwives tend to labor with their client. So if you're being admitted to the hospital or to the birth center, or if we're coming to your house, we're there with you until you have your baby. And I remember a lady came in after me who had a midwife, and you could hear them in the other room, and she had her baby so many hours before I had mine. And so I went to midwifery school, and my second child was born on Saturday, and midwifery school started on Monday. So, you talk about juggling children and family and work, and I remember those days well. I think the greatest joy is being with a family through the birthing experience. Pregnancy is a long time, so you get to know the family, and then people have another child, and then their sister has a child, and their cousin has a child, and I think the greatest joy is being a part of some stranger's family in the most important time of their lives.
Yeah.
As you tell the story for years and years, Mommy, tell me about my birth, then those midwives, those birth workers are included in those stories, and what an awesome honor it is.
So your first child was born in a hospital, and your second child was born
In a hospital
as
But
well.
the second time was with a midwife.
Yeah. Okay.
And the experience was very different.
Okay, can you maybe talk a little bit about some of the differences of those 2 experiences?
When I talk about pain with pregnancy, with labor, I say pain is this small amount, and then the actual physical pain, but then you add the fear. And so that's what makes people say, oh, yeah, it was tough versus it was excruciating. It's usually the fear added to the actual pain. And lots of times it's just because you're alone.
Yeah.
And I kept begging for them to call the physician into the office, into the labor room. And it was the middle of the night. It's not time yet. But I just needed someone to reassure me that I was okay.
Yeah.
And so when I had my second child with the midwife, I was laboring, and I remember my midwife was just sitting there knitting. And so whenever I needed her, she was right there. And so the labor was much quicker, it was much less painful, and a much nicer experience.
And Allie, could you tell us a little bit about the differences between your own pregnancies and births? Because I know that you had a child in the hospital and that you also had a child at a birthing center. So if you can just tell us a little bit about those differences.
So me and Robert were both born in Borough, so I really wanted to have my kids here. And my labor started a little bit early, so I went into the hospital, and they thought, I was going back and forth throughout the day. And so they just said he's like going up and down. So we don't know if he is having trouble. So we have to send you to Anchorage just in case something bad happens. They can't do C-sections here. So they didn't want, the time for a medevac takes up to 4 hours. And that's too long, when you're giving birth. So I was sent to Anchorage, which was not part of my plan, so it was really frustrating because I had, at the last minute, I had to pack everything for my first child. I didn't know what I was doing, and they sent me to Anchorage on Alaska Airlines by myself because there was just only one seat left. So I was definitely scared, but I was having contractions the whole flight.
Oh my goodness.
And so Robert was able to make it that night, but I was in and out of the hospital. We stayed at patient housing, and the experience was pretty good. It's just not what I would have wanted. So when we decided to have 4 kids, I did a bunch of research on birthing centers and home births. We didn't have that option here in Borough, so I found a birthing center in Anchorage who was run by a midwife, and I ended up giving birth to both my girls, the younger ones, at the birthing center. And that experience was, I hope everyone gets to experience that, honestly, because it was just like being at home. For Robert, I think it was uncomfortable because there was a bed, there was a couch, and we were just kind of hanging out, and he was really confused because it's way different from the hospital. You have nurses in and out, the doctors in and out, and my midwife, I wasn't used to that. So I'm like, what are we supposed to be doing? What are we supposed to be doing? And she's like, this is the baby's story, it's not yours. When it's her time to come, then she'll come. But until then, we just wait until she's ready to come. And so she just sat with me. She massaged my back and just made me feel comfortable, and it was an amazing experience. When I gave birth to my son in the hospital, I remember I just gave birth and I was holding my son, and I heard a mom next door just like screaming, giving birth, and I was like, oh my gosh.
Wow.
But at the birthing center, it was just us. It was really calm, very, like, my midwife was very supportive, and she, they ask you what you want to do. They're not like at a hospital. I feel like this is what you're going to do, and this is how we're going to do it. So I feel like midwives are just like more supportive of your decisions, and I hope everyone gets to experience that, because going through birth is like it's a very intimate, painful, scary time.
Yeah.
And to have people that are with you that are very supportive and loving, and I think everyone should experience that for sure.
I kind of think about it as whose house is it?
Yeah.
Right? So if you have a home birth, it's your house. And anyone who enters your house, you know, you go in as a guest. You know, you wouldn't just go in and rearrange furniture and take pictures off of the wall because you're a guest in someone else's home.
Yeah.
In the hospital, the client is kind of a guest in the hospital's home. I think the birth center is kind of this third space, right? Where I think there's more equality.
Yeah.
I love personally as a certified nurse midwife, I've been a certified nurse midwife for 30 years. Personally, I prefer hospital birth work. I like working in a hospital. But I've also done birth center work. I've not attended home births, but it's not that I'm against them. I think that if you have a midwife, you always have a physician.
Yeah.
Right? There are things that midwives don't do that only physicians do, that only surgeons do. So it's not anti-physician or anti-surgeon. It's what does this particular family want? And sometimes we get what we want, and sometimes we don't.
Yeah.
And so then what's the way to change that plan to the hospital? So most out-of-hospital situations, either home births or birth centers, have a system in place of transfer, you know, and they'll have rules. Well, you've been ruptured for so many hours, or, you know, you've not made adequate progress in a certain amount of time. Now it's time to think about moving from the home or the birth center to the hospital. And ideally, those relationships have already been set up so it's seamless.
Yeah.
So, so that then you can be welcomed and be in that higher level of care, and not just let all of your birth plans go, but then how do we adjust them for this new environment?
Yeah.
And ideally, that's what a doula does. That's what a midwife does, that they go with you. Because, you know, you're having contractions, boom, boom, boom. You're not saying, but really what I wanted was I wanted to have juice, and I wanted low lights, and I wanted this music. You go, so you need those other people
Yeah.
to speak for you in those words that you've already decided for yourself.
So I had two questions that kind of came up from that. So the first one is, you know, Ali, you talked about how you had to leave home to go give birth, right? And I think that's probably a common thing that happens up here on the North Slope. And I'm just wondering if, Theresa, you could talk maybe a little bit about, I guess, some of like the challenges that come up for something like that.
I don't know what the answer is, but I know it's a pressing question that deserves an answer.
Yeah.
I think birth is a family experience. When I think back to the births that I've attended that have been the most meaningful for me, there's the birthing person and maybe her mom and maybe her partner's mom and a grandma or auntie, you know, and everyone is there. Sometimes they're in the room, sometimes they're out in the hallway, and one will poke a head in, another one will poke a head in. And so then if you can't birth in your community, then where are those witnesses?
Yeah.
Where is that familial support? Obviously, safety is job one, right?
Yeah.
We don't want anything bad to happen to mamas. We don't want anything bad to happen to babies. But how can we deserve to be surrounded with our family just in the same way that people who live on the road system have that opportunity.
Yeah.
And so it's super tough. And right now, if you're normal risk you have to be where you're going to have your baby at 36 weeks.
Mm-hmm.
So then, that's fine maybe for the first baby. But what about the second baby? What about the third baby? What about the bonus baby when all your kids are in school? Do you pull everyone out of school for a month? I mean, it's really tough choices that we ask families to make here.
Yeah, and it can be very disruptive, right? Disruptive to like the lives of everyone around you, and also just like disruptive to yourself, right? And I mean, you were lucky that Robert could join you and be there for you even in that hospital birth, but I can imagine it was scary, right? It was scary, unexpected. So yeah. And then I guess my next question is, what types of birthing options are available for people on the slope?
I think we have all the options that are available to everyone. We may have to travel. Samuel Simmons is the bedrock of the care that we offer here. The providers are wonderful. I've worked with many of them, have nothing but good words to say about the care that they provide. And they're also great partners. So if you're like Allie who says, I want to have my care here, but I'm planning my birth at the birth center, then they will work very well to make sure that the receiving group has that information and has all the data. And so I think it's a beautiful option. It's not as seamless for the people who live in the outlying villages, but I think it's probably as close as we have right now. And I think that there's some good work being done in Canada, looking also because, none of it has the same situations that we have. We're far away from higher levels of care, but have lovely homes where we are and want to continue to live our lives. So what are the ways that we can bring midwifery? That's something that we're continuing to look at.
Yeah. In your own research, what types of options did you find in Alaska?
Aside from the hospital births, there were the birthing centers.
Mm-hmm.
But my midwife was also, we had the option for her to come to where I was.
Mm-hmm.
But since Anchorage is not my home and I didn't have like my own space, it was better to go to the birthing center. But my cousin, she lived up here for a while and then moved to Anchorage. She is a doula.
Yeah.
She came to my births. They have a organization that helps mothers who travel from the villages, from Borough, all over Alaska, and they'll go and just make you feel at home.
Yeah.
Because being pregnant is already kind of uncomfortable.
Yeah.
Waiting to give birth, like you're not at home, you're not working anymore. Like, what do you do? Some people can't bring their kids, so it gets pretty lonely. So they have the organization that comes and they just bring you food, bring you native food, sit with you.
Yeah.
They have different activities for mothers.
Yeah.
So I was able to do that with, my two younger ones, and Aubrey was my doula, and it just made it that more comfortable,
Yeah.
like more feeling at home, I guess.
Mm-hmm.
And, she just walked with me in the hallways. I think before I gave birth to my second daughter, my second child, Robert went to go get Wendy's and we all just sat and ate donuts and,
That's nice.
yeah.
Yeah.
You're just like walking the halls and it was just like hanging out.
Yeah.
Which didn't make the birthing experience that scary when but when it was time for her to come,
Yeah.
it was all really quick. And having a doula, I think knowing what a doula is and the support that they give, I think is really important for moms. Because some people, their husbands can't come, their moms can't be there, and having a doula, they're just supportive, and I'm really glad that I had that option.
Yeah. It's like helping to create almost like a sense of safety, right? Because you're in an unfamiliar place with unfamiliar people, and just having, I guess, kind of like that anchor of like, this is safe, it's gonna be okay, I'm gonna support you through this, is probably so helpful. And I guess for our listeners out there who don't exactly know what a doula is, can you tell us a little bit about your experience of having a doula, I guess from the start to the finish?
So a doula is a non-clinical person who is trained to be a support.
Yeah.
Trained also to be an advocate. I think when we've had babies before, we kind of know, oh, we'll do this different next time. But to, make sure simple things like a birth plan. What's your birth plan? What's your dream birth? And so then it's part of their job to go, guard that dream. Very often they'll come to your house beforehand if you're someplace where they're able to do that, and kind of help and make sure that you're set up for baby. That, oh, remember you really, when you had your last baby, you really loved those popsicles. Make sure you have those ready for you. And then they're with you in labor. Sometimes they're with you at home in early labor because, like Allie mentioned, sometimes you're contracting, but it's too early to be in the hospital, and you still want that support. And then they'll travel with you to the hospital or the birth center. And then they also come to your home postpartum and help out, because the idea is that after you have your baby, it's really that dyad, it's you and your baby. You should just be focused in, but there's this whole world in your house.
Yeah.
And they're also there to support the rest of that world in your house, so you don't feel pulled away from your baby. Yeah. There's really great research that says that your labor is shorter when you have a doula. It's less painful when you have a doula.
And I think what's coming to mind with this conversation is kind of like this sense of having choices, right? And having a voice while you're pregnant, and having a sense of like autonomy over your own body, because as when you're pregnant, like as you said, your body is changing so much, right? And I've heard people say that like when they're pregnant, their body feels like a foreign place, right? And I think it's important for people to know that they do have choices, they do have a voice, and that they can kind of advocate for what they want for a pregnancy within, I guess, like within the range of like health safety, right?
And a hospital is a choice.
Yeah.
And an epidural is a choice.
Yeah.
And there's some discussion about planning with your physician an induction of labor. I think right now we're talking more about a natural thing, but it's also a choice to say, look, I want to have my baby on the 23rd. I want to go in, I want to get my epidural placed. I want them to start my induction. I'm watching TV and I'm reading a book until it's time to have my baby. Because sometimes people feel shame because that's their preference, right? Now there are risks associated with that, but it's still their preference and their choice. And it's just as valid as someone who says that I want to have a water birth in the sea.
Yeah. I think that's important, right? That their choice is just as valid. And all choices, I think, when it comes to pregnancy are valid, because we are each individual people, right? We have different pain tolerances, we have different ideas of like pregnancy and what birth is. And so I think that's an important point to make, that every choice is valid.
And I think the important other thing, kind of in the time of TikTok, you cannot learn enough on YouTube to take care of yourself having a baby by yourself. There are physicians who have gone to school for years and years and years and years and years, and there are nurse midwives who've gone to school for years and years and years. There are professional midwives who've gone to school for years and years. And so, and I think for us as the public, it's hard to tell what is really unsafe to be outside of the hospital. And so we really have to, our job as an individual is to pick the provider who's in line with you. And then after you pick that person, then you really have to rely on their expertise, because they bring that. And we really only want to the best of our abilities, the very best birthing outcomes.
Yeah, and I think the physical safety, right, making sure that you're physically safe is important.
I wanted to mention, I think how we are growing up here, like, when the hospital like suggests something and, that we do it.
Yeah.
But as, after my first experience, I realized that I have other options.
Yeah.
And I think what's important is to let others know that you do have other options if that's what you want. Many people want to go to the hospital, they would like to have an epidural. You don't have that option at a birthing center.
Yeah.
The birthing center is more natural, so if you're not comfortable with that or if that's not what you're looking for, then the hospital is a better option. But ANMC, I know they do provide midwives, and Umbra's organization does work with ANMC a lot to be there for them. So they're becoming more integrated with the hospital system. They don't have doulas up here though.
Yeah.
But I think it's important for others to know that they do have other options.
Yeah, and I guess it's important for people to even just sit down, right, and have that conversation with themselves, with their doctor, like, what is it that I actually want, right, and that there are options, and there's like so many different options out there for whatever your specific needs and your specific desires are. So yeah, I think that's important.
I wanted to say something real quick about fear. Some people are really afraid of, well, if you have your baby at home, what happens if things go bad? Or if you have your baby in the birth center, what happens if things go bad? If you have chosen a qualified person, they will continually evaluate the appropriateness of your being there.
Yeah.
So if you choose a physician in the hospital has evaluated that they are appropriate to be working there. And so then you can say, well, I like Dr. X over Dr. Y. That's a different discussion. But they're all equally qualified.
Yeah.
But when you choose a birth center or when you choose a home birth, it's your job to figure out, midwife is kind of like a shirt. A lot of people can call themselves a midwife, and all of us have different levels of qualification. So that means it's your job to do your homework to make sure that the midwife you've chosen is actually the midwife that you were looking for, that their credentials and their skill set lines up. And I think if I heard you right, Allie, you said that your midwife could follow you to the hospital, so that if something happened and you needed to be in the hospital, that midwife could still be your provider.
Yeah, my midwife, she said they meet quarterly with like the hospitals and stuff, so they have like a time frame of getting to the hospital, which was like 2 minutes from the birthing center. She made sure to tell Robert all of this information because he was definitely nervous. So we went over that a few times. He asked all the questions, like what happens if something goes wrong. He asked all those questions, and they were able to answer that. They had some stuff on hand for some accidents. I ended up losing a lot of blood, and they had all the stuff to help me for that. But they do work with the hospitals and emergency transfers. They meet quarterly on that, so that's a priority for them.
Yeah, so there's definitely a level of safety.
But there are some that don't.
Okay. Yeah.
Who just will say, well, hop in a car and go to the emergency room. And so that's why I'm saying it's your job to ask those questions. What if something goes wrong? What's the plan?
Yeah.
What's your connection with the hospital? Is there if you can't take care of me in the hospital, if you don't have privileges, who are you transferring me to?
Yeah.
Or will I just show up at the emergency room, right? So sometimes it may be better for you to have less choices, but to know that you're in a system that's safe. Or to say, I'm going to do all of that myself to ensure that my baby and I are fully safe.
Yeah. So I guess my next question then is like, so for people who are newly pregnant or people who are planning to get pregnant, right? Like how can they even begin to find these different resources?
I'm going to say start care at Samuel Simmons early. Early prenatal care is super important. Let's diagnose any undiagnosed things that might make you more at risk. And then I would have the conversation there and say, hey, I was thinking about having a birth center birth. What do you know? Or I actually have a house in Anchorage and I'm thinking about a home birth. What do you know? And then I would also reach out to to Abra's organization. I bet you they have a long list of people in the Anchorage area. There's some people here who choose to birth in the Fairbanks area, and I would reach out to those folks as well.
And what is the name of Abra's organization, just for our listeners?
I believe it's the Alaska Native Birth Workers.
Moving on. So July we're gonna switch gears a little bit, but July is National Breastfeeding Awareness Month. So can you tell us a little bit about your own experience with breastfeeding, the challenges that came from that, and also just provide some general knowledge that can be helpful for new mothers?
So I breastfed all three of my kids. I was very set on breastfeeding my first child, but I just I struggled with getting him to latch on. And all of my friends and family said, don't give up. And I ended up giving up, and then I pumped for a whole year.
Oh wow.
For a whole year. Wow. And so with my daughters, I decided I'm not going to ever pump. And so I breastfed them for over a year.
Yeah.
My youngest was the longest.
Yeah.
She just wouldn't get off. But it's definitely hard. You just gave birth and then you're trying to breastfeed a baby. So that whole experience in the beginning is very stressful.
Yeah.
And mothers think like, do I have enough milk? But they're newborns and they don't require a lot of milk. Like your body will produce as much as the baby needs.
Yeah.
I know that some mothers have a hard time producing milk, so it's not like for everybody.
Yeah.
But for mothers that are breastfeeding, I would just say, if you would like to breastfeed, don't give up. Because it is stressful in the beginning, for sure.
Yeah. I've heard people tell me that they really struggled with breastfeeding, right? And it becomes almost like a reflection of themselves. Like, is there something wrong with me because I can't breastfeed? And there's like, I've heard from people, right? Like there's almost like a level of like shame. Sometimes like it's shame and fear and that comes into the whole situation. But as you said, like maybe breastfeeding is not for everybody. And
I think we put too much pressure on ourselves.
Yeah.
If we're set on breastfeeding and it's not working out, you're not producing milk, I think as mothers, we feel like, what are we doing wrong?
Yeah.
Like, what can we do better? But I gave my kids formula at some point. I think as long as the baby's healthy and fine, I think it's okay. There are benefits to breastfeeding for sure, but if our bodies can't do it, formula is perfectly fine.
Yeah. Is there anything that you can add to that, Theresa? Or
Well, the earlier you put baby to breast, the less problems you'll have. And so even when you have a C-section, they can still put baby to breast while they're finishing your C-section.
Oh, wow.
So if you're someone with a scheduled C-section, you can say, hey, I still want baby to breast. There are protocols, so that can happen. Try real hard not to give formula in the beginning.
Or a binky, or a pacifier.
Right, or a binky or a pacifier. I think it's all about trusting your body. Ellie, you're right on. Babies don't need 4 ounces of milk in the first day of life.
Yeah.
They come out with enough that they need nothing for the first day. So the entire day is just practicing. So just let it go. My baby is not starving. my baby is not starving.
Yeah.
Let's take this time. And so when I had my first child, I nursed. He didn't nurse well. It was my first child. I didn't know. It was because he was sick. And so he ended up in the NICU. And so I was so stressed with him being in the NICU, I wasn't pumping. And so my milk was just gone. And so when I had my second child, I nursed her well. But like I said, she was born 2 days before school started. So I was back at school. And the thing that I want to remind everyone is you can partially breastfeed. So I would leave school, nurse all evening, nurse through the night, nurse first thing in the morning, and then I formula fed. Well, they formula fed at the sitters.
Yeah.
And I always knew it was almost time to get out of school because you could feel the milk.
Oh, wow.
Yeah, and so it will adjust.
Yeah.
And the other thing, which I think is miraculous, is somehow it figured out when it was Saturday and Sunday, and I would just nurse the whole weekend.
Mm-hmm.
And so I kept formula at the sitters, and then I nursed that way for a year.
Yeah. Can you maybe tell us a little bit about like the differences between breastfeeding and formula, or if there are big differences between those two?
Well, you're getting all of your immunity.
Mm-hmm.
So everything that I'm immune to, I can share my immunity through the breast milk with my baby.
Mm-hmm.
You're not going to get that with formula. I think that in terms of nutrition, they're very similar.
Yeah.
I think that in terms of bonding, and I'm not a breastfeeding expert,
Mm-hmm.
but your baby has lived inside of you, listening to your heartbeat for its entire life.
Yeah.
And so then to be right here, right there, right back at the heart, right back at home, smelling you, being that close to you with that skin to skin is amazing. There are all of these, and the word fails, but for lack of a better term, I'll say hormones.
Mm-hmm.
And I know it's not the right term, but like if a baby falls or does something and they hurt themselves and they cry, if you put them right back to breast and you're smiling, they just go like this. And that's what we're giving to our baby. And so, yes, formula, breast milk, they will both grow and be healthy.
Yeah.
Right? And so I think it's kind of the decision that you make. Do you always have vegetables with every meal?
Mm-hmm.
Or, do you have a lot of spaghetti? So I think sometimes people will choose not to breastfeed because, well, I don't eat well all the time. Well, you've been eating the same way through your pregnancy. Just do the best you can.
My second child I found out she was colicky.
Yeah.
So I had to change my diet. I couldn't have cabbage, I couldn't have broccoli,
Mm-hmm.
So that was very difficult.
Yeah. It's so interesting, right? How like what's happening in your own body affects the body of the baby. I think that's super interesting. Okay, so I just have two more questions. The first one is, what were the most challenging and rewarding parts of your journey as mothers, as a birth worker? If there's anything specific that you would like to share.
I think for me, the most rewarding part is just being a mother and seeing my kids grow. Every day they're learning something new, and it's like the small things they're so excited about, and just the love that they have for me. It makes it all worth that. All the pain, all the birthing, all the sleepless nights, just the affection that they show me as a mother, or their siblings or their dad. It makes it all worth it for me. And watching them grow and healthy, they're happy. That's the most rewarding part.
Yeah, that's beautiful. And you, Theresa?
I'd say the same thing. And you're probably, my kid's age, but when I see my children, it's almost like I see them still as babies.
Yeah.
And then you think about all that they've learned how to do, all that they've accomplished in their lives. And now I have grandchildren, and to see them as all, kind of little versions of their parents that were my kids. And to hear my kids say, Mom, you really were right. That's all we ever want to hear. Mom, you really were right.
My mom always tells me, she says, there are so many things that you'll never understand until you actually become a parent.
Yes.
Right? And another thing she'll always say is like, no matter how old you are, no matter how old I am, you're always going to be my baby.
Right.
You're always going to be my child. And like, that doesn't ever change. So I think that bond, the family bond, is something which is so special and so beautiful. So thank you for sharing those things. And for my final question, is there anything else that you would like to add or share with our listeners today?
Don't beat yourself up. We don't have control over our lives. We say that we do. Maybe we want to have 1 million children and maybe we're infertile.
Yeah.
That means adopt babies. I mean, we can always make the life. It may not be just what we wanted, but it can be a wonderful, beautiful life.
That's beautiful. Thank you.
Thank you, Ali and Theresa, for sharing your time and your personal stories. Each motherhood journey is unique with its own challenges and rewards. And as we've seen, there is not just one way to do things. And it's important to honor your body and baby by finding what works best for you. For today's wellness practice, we'll spend some time honoring our bodies with the body scan. Let's start by taking 3 deep breaths to find some stillness, to ground ourselves in our bodies and in the present moment. We'll breathe in through the nose, sending the air all the way down into the belly. Then sigh it out. Breathe in. Sigh it out. Breathe in. Sigh it out. Now allow your breathing to return to normal and just notice how you're feeling in this moment. Are you feeling relaxed, scattered, rested, tired? Whatever it is, put it into a sentence. In this moment, I am feeling relaxed. Now we'll move on to the body scan. We'll start by closing our eyes and then bringing our attention down to our feet. Begin observing sensations in your feet. You might want to wiggle your toes a little, feeling your toes against your socks or shoes. Just notice without judgment. You might imagine sending your breath down to your feet, as if the breath is traveling through the nose, through the lungs, through the abdomen, all the way down to your legs and your feet, and then back up again through your nose and lungs. Perhaps you don't feel anything at all, and that's fine too. Just allow yourself to feel the sensation of not feeling anything. When you're ready, move your attention to your ankles, calves, knees, and thighs. Observe the sensations you're experiencing throughout your legs. Breathe into and breathe out of the legs. If your mind begins to wander during this exercise, gently notice this without judgment and bring your mind back to noticing the sensations in your legs. If you notice any discomfort, pain, or stiffness, don't judge this. Just simply notice it. Observe how all sensations rise and fall, shift and change moment to moment. Notice how no sensation is permanent. Just observe and allow the sensations to be in the moment just as they are. Breathe into and out from the legs. Then on the next breath out, allow the legs to dissolve in your mind and move the sensations into your lower back and pelvis, softening and releasing as you breathe in and out. Slowly move your attention up to your mid-back and upper back. Become curious about the sensations here. You may become aware of sensations in the muscles, temperature, or points of contact with clothes or furniture. With each out breath, you may let go of any tension that you're carrying. And then very gently shift your focus to your stomach and all the internal organs here. Perhaps you notice the feeling of clothing, the process of digestion, or the belly rising or falling with each breath. If you notice sensations arising about these areas, gently let these go and return to noticing sensations. As you continue to breathe, bring your awareness to the chest and heart region and just notice your heartbeat. Observe how the chest rises during the inhale and how the chest falls during the exhale. Let go of any judgment that may arise. On the next out breath, shift the focus to your hands and fingertips. See if you can channel your breathing into and out of this area as if you are breathing into and out from your hands. If your mind wanders, gently bring it back to the sensations in your hands. And then on the next out breath, shift the focus and bring your awareness up into your arms. Observe the sensations or lack of sensations that may be occurring there. You might notice some difference between the left arm and the right arm. As you exhale, you may experience the arm soften and release tensions. Continue to breathe and shift focus to the neck, shoulders, and throat region. This is an area where we often have tension. Be with the sensations here. It could be tightness, rigidity, or holding. You may notice the shoulders moving along with the breath. Let go of any thoughts or stories you're telling yourself about this area. And as you breathe, may you feel tension rolling off your shoulders. On the next out breath, shift your focus and direct your attention to the scalp, head, and face. Observe all of the sensations occurring there. Notice the movement of the air as you breathe into or out of the nostrils or mouth. As you exhale, you may notice the softening of any tension you may be holding. And now let your attention expand out to include the entire body as a whole. Bring into your awareness the top of your head down to the bottom of your toes. Feel the gentle rhythm of the breath as it moves through the body. And as you come to the end of this practice, take a full deep breath, taking in all the energy of this practice. Exhale fully. And when you're ready, open your eyes and return your attention to the present moment. As you become fully alert and awake, take a moment to ask yourself, ask your body, what does it need from you today? Is it rest? Is it movement? Is it time spent outside? A nutritious or delicious meal? A good laugh or cry? Whatever comes up, can you set the intention to give your body what it needs today? To show your body some love by doing something nice for it, whatever that may be. Thank you for doing that practice with me. If there's anything from this episode that you'd like to learn more about, or if you have any physical, mental, or emotional health questions that you'd like to be answered on the show, please reach out to me by email at olivia.kim@north-slope.org or by phone at 907-852-0366. Please note that we record our episodes in advance, so the answer to your question will air a couple of weeks later. Thank you so much for tuning into the show. We hope you found it insightful and learned something that can help you on your own health and wellness journey. Next week, we'll be discussing the important topic of grief with Chastity Ulimau. If you'd like to catch the replay of the episode, you can visit the North Slope Borough Health and Social Services YouTube page. Until next time, Kouadio.